Thank you for choosing SoloPap. These instructions will help you to get the most accurate results from your test.
SoloPap Use and Application Guide. Thank you for choosing SoloPap. These instructions will help you get the most accurate results from your test. Please read and follow them carefully. It is important to note that the most common cause of false negative pap smear is sample failure, which means that no abnormal cells are present in the sample. To minimize the chance of sample failure, avoid intercourse or the use of showers, vaginal medicines, spermicidal foams, creams or jellies for 2 days prior to performing the pap test. These may wash away or obscure abnormal cells. The best time to have a pap test is between 10 and 20 days after the first day of your menstrual cycle. If you are menopausal, you can take the test at any time. A. Disposable gloves. B. Tube speculum. C. Introducer. D. Brush sampling unit. E. Lubricant. F. Sample container. G. Biohazard bag. H. Pre-addressed mailing bag. I. Customer ID card. J. Patient consent form. K. Consent policy card. L. Instructions not pictured. Obtaining the pap smear. Before proceeding, find a private, comfortable place where you can undress, lay down, and still have access to the kit materials. It will take about 10 minutes to complete the sample collection steps. Wash your hands with warm water and soap and dry them before proceeding. Gloves are provided for your protection, but they are optional. You're gonna do great. Step 1. Put on the gloves. Make sure the brush is fully seated to the brush holder. Remove sample container lid. Slightly cover the rounded sides of the introducer, try avoiding the tip with a thin layer of lubricant. Lubricant may also be placed at the opening of the vagina for added ease of insertion. Step 2. Lie on your back with your knees bent and legs spread. With your thumb and index finger, gently and slowly insert the tube speculum into your vagina. Insert to about half the tube's length. As the device enters the upper portion of the vagina, it will be easier to move. Insert until the center ridge on the tube speculum is at the vaginal entrance. This will let you know that it's in the proper position. Leave the tube speculum in place and remove the introducer. Step 3. Insert the brush handle assembly into the tube speculum. Be careful not to disturb the position of the tube speculum as you do this. The brush sampling unit needs to be inserted all the way or only until you feel some resistance. Rotate the brush clockwise 10 turns using the wheel end. You may also feel some cramping. This is normal. Step 4. Immediately insert the brush into the solution in the sample container. Pushing against the sample container wall, swirl the brush vigorously and rotate at least 10 times. This releases the cells into the solution for laboratory analysis. Remove the brush from the solution, then discard it. Step 5. Within 2 days of taking the sample, place the sample in the biohazard bag and then place the biohazard bag in the pre-addressed mailing bag to return the sample to the lab. The sample should be mailed at a post office and not put into mailbox due to temperature limitations of the sample 2 degrees Celsius to 37 degrees Celsius. Put your name and customer ID number on the sample container and fill out the patient information form and the patient questionnaire with your customer ID number at the top of the form and return both items with the collected sample. Also, add the customer ID number to the informed consent policy card and keep it in a safe place for your records.